My name is Wilma Schroeder. I'm a nurse and family therapist, and I've been teaching family nursing at Red River College in Winnipeg, Manitoba, Canada, since 2001. My background is primarily in mental health, and I have a special interest in families with schizophrenia. I had a private practice in family therapy, but have been a full-time educator for several years now. As an educator, my primary focus is on skill development in student nurses working with families. I'm going to talk about teaching the skill of circular questioning using a co-op learning technique. I used to teach circular questions, which are an important tool in family assessment and intervention, through a lecture format, and I would tell the students what these questions were and give them examples and expect them to know it. And I found that they were not learning them very well. They had a lot of difficulty with this concept. Since we have a new nursing program at the college and I now have a smaller class size, I had the opportunity to teach this in a different way. So I've set up a co-op learning situation. The premise of co-op learning is that the students actually learn from one another and they do the teaching. However, the teacher has to set it up for them ahead of time so that they know what to do. So I give them some reading on circular questions to do. They're to come prepared, having read that, and to bring either their textbook or a worksheet about circular questions with them. And then in the class, I'll do a brief introduction. I put them into groups of 3 or 4 if it's an odd number, and then split each group up. So within a group, you have student A, B, and C. Student A will all go to the difference question station. Students B will all go to the behavioral effect question station, and students C will all go to the hypothetical question station. There they have some resources and worksheets that they will work on understanding that particular type of question. They're to come up with examples of their own of circular questions that they would use to target the cognitive, affective, or behavioral domains of a family member. So I circulate around the room and I answer their questions and help them out, but basically they are teaching themselves and one another. After they have finished their task at that station, I bring them back into their original groups, and now they will teach each other. So student A will teach her 2 peers what are difference questions and help them to develop a new example of a difference question. Student B will teach her peers what's a behavioral effect question, and student C will teach her peers about the hypothetical question. We follow this with a debriefing, and I ask them a variety of questions about what they learned, how these particular types of circular questions might be used, and what's the difference between a linear and a circular question, and so forth. They hand in their worksheets to me, and I check them over just to ensure that they have in fact taught one another correctly. What I have found with using this technique is that not only are they performing better on test questions on this type of method, they are also spontaneously adding circular questions into their plan for the family home visit that they do. So they are integrating the knowledge much better. I think the implication of this is that active learning is a much better tool for learning a complex skill, such as circular questioning, than simple passive learning, such as a lecture format. And the students enjoy it as well. They tell me that they really like this activity, so that also helps the learning.